With any injury, for me, I classify them into acute injuries, such as broken bones, fractures, and things of that sort, and overuse types of injury. With the shoulder, a lot of the things that we see are overuse, a tendonitis or injuries to the rotator cuff, arthritis where the collarbone meets the shoulder blade. Again, here in West Palm, we have an older population, but they tend to remain very active. So, and over time, the tissue is not as resilient as we age, and they end up with injuries, either a tendonitis or partial tears, and those need to be evaluated and treated appropriately for them to continue in their normal activities. Initially, when you evaluate a shoulder, first and foremost, you have to come up with the proper diagnosis. I have lots of people who come in who've been told they have one thing wrong with their shoulder, but with a proper type of diagnosis, you can direct the treatment better. The goal, in my opinion, of any orthopedic surgeon is to keep people out of the operating room. If I can treat you with conservative care, whether it be physical therapy, injections, braces, or modification of activities, that's the first goal. As we progress through, like I said, we begin with medication and physical therapy for most of the shoulder overuse types of injuries. If they fail that, then we move forward to cortisone injection. Nobody likes to have a cortisone injection, but they're very useful around the shoulder. If they fail then cortisone injection and continued physical therapy, then and only then do I start to move to MRIs. Because when I start thinking about MRIs, I start thinking about operations. The MRI, as opposed to the X-rays, can show us damage to the soft tissues. And a lot of those injuries can be treated arthroscopically through small incisions with cameras inside the shoulder joint and minimally invasive surgery, which obviously has quicker recovery. With arthroscopic surgery, it allows us to treat a variety of disorders around the shoulder, from the athlete who has a traumatic injury, a dislocation with tearing of some of the cartilage and some of the ligaments, that whereas when I was training, a lot of those things were done through a large incision, large open procedure. We now have the technology to do it arthroscopically. Arthroscopic surgery is usually done as an outpatient, so no hospital stay. You come in the morning, go home in the afternoon. We usually make 3 small, sometimes 4 small incisions about the shoulder, each one maybe a centimeter or less in length. Through one of the incisions, it allows us to place a small camera inside the shoulder joint, which allows us to evaluate the bones, the ligaments, the soft tissues, the tendons, and then through the other incisions, we can repair those tissues. In the shoulder joint, a lot of times it involves repairing that tissue back down to the bone that it's torn away from. So technology is such today that, again, through these small incisions, we can secure that tissue pretty reliably through these smaller incisions.